welcome everyone to the Canadian Breast Cancer Network's session today on understanding the role of genetic testing and genetics. My name is Jen Gordon. I'm the Director of Operations with the Canadian Breast Cancer Network. Just to go through a couple housekeeping items before we begin our session today. We will be recording the session. So if you're hoping to share this with a family member or friend, it will be recorded and available on the CBCN website, cbcn.ca. And I will put the link to the webinars page in the chat in a little bit, but it will be up usually within a couple of days. So check back later this week. And all of the other webinars and questions and expert series that we've hosted before and are recorded are also available on that link. So I'd encourage you to sift through there and see if there's information that may be helpful to you or your family. In terms of the format for today's session, we will have a presentation by our expert speaker, followed by time at the end for questions. I would encourage you to submit questions throughout the presentation, if that's easiest for you, using the Q&A button. It's usually at the bottom or side of your screen. And then also at the end of the presentation, obviously, you can continue to submit your questions and we will try to get to as many as possible. I would like to extend our sincere appreciation to our sponsors for our session today. So our gold sponsor, Viatris, silver sponsor, Novartis and Merck, and our bronze sponsor, AstraZeneca and Pfizer Oncology. And on that note, I'd like to welcome our host for this session, Kathy Amanda Lea, who is the chair of the board of the Canadian Breast Cancer Network. Kathy, welcome, and I'll turn it over to you.
Thanks, Jen. So welcome again, everyone. Nice to have everyone listening today. Thank you for joining us, and I'm really looking forward to our session today. And learning more about genetics as it relates to cancer. Joining us, as you know, as our guest expert speaker for the session is Rachel Mador-House. Rachel is a board certified genetic counselor with a Master's of Science in Genetic Counseling and a Master's of Science in Molecular Genetics. Rachel was the genetic counselor and clinic coordinator for the Maritime Newborn Screening Program and also worked at the largest hematology oncology clinic in the Western United States. She is currently the clinical science liaison lead with Invitae. Rachel, it's wonderful to have you here with us today, and I'll turn it over to you to share your presentation for this session. Thank you.
Oh, well, thank you so much for having me. What a lovely honor to be joining you today. Hi, I'm Rachel. I'm a genetic counselor and genomic scientist, and I'm really excited to be able to give some information about hereditary cancer and what you and your family might gain from learning about this topic. So just a little bit about me. I'm, as I said, I'm kind of a genetics nerd. I really like to provide science-based information to my community. It's one of my main goals, and I've done that in many ways through many years. But I really want to help raise awareness and education because here in Canada, this is my community, my family, my friends, and myself. So I want to make sure that we all have access to really high quality information to make sure we're able to make decisions about our healthcare for ourselves and our family that are based on really good science. And I'm here to help provide any resources or information that is important. So always please feel free, reach out to me if you think I can be helpful. And really that just all goes to the same main message that I'm here because I think information is power. I don't really think that information by itself can be harmful. I think that if we can all bolster our own understanding of our own health and what it means, what hereditary cancer or what our genes mean to our health, that allows us to make great decisions about our health and help have really good conversations with our healthcare providers and our community to help make sure we're getting what we need. So before I delve into, the topic of the day, genetics and cancer, I thought, let's just start with the basics. The basics being what causes cancer. And I know that this seems like a really easy question to answer, but if you ask a bunch of different healthcare providers what causes cancer, you might get a bunch of different answers. So let's start from this beginning. So most cancers are caused by damage that builds up in our bodies through the normal aging process, through our environment, and through our lifestyle. So these are factors that damage our cells, and sometimes this damage builds up to create a cancer. Okay, so that's the basics of how cancer happens. It's just that our bodies, as we age, we're bombarded by, breathing in pollution, the plastics in our food, maybe there's something in our environment that's not the most healthy for us. And not speaking for any of you, but for me, I don't always live my healthiest lifestyle every day. So all of these things together mean that every day that I wake up, I have a little more damage in my body than the day before. And over time, the accumulation of this damage can injure my body, the cells that create my body, into causing a cancer. So it's kind of something that can happen over time, but it's usually not just one thing. So some of these damaging factors we have control over, like our diet, exercise, and to some extent our environment. But some of these factors we don't have control over. So if anyone who's listening has some kind of way to prevent aging, I would definitely like to hear it. Get in touch. But for most of us, we don't really have control over a lot of the factors that can go into our bodies developing a cancer. So that's called sporadic cancer. It's sometimes referred to as cancer by chance. It's just a cancer that pops up in one person, but wouldn't pop up in another, even though they've both accumulated damage in their body over time. So although we can appreciate it's not really chance, it's a combination of factors that go into making somebody's body damaged enough to produce a cancer. We still are hear it being called as cancer by chance. So basically multiple factors working together damage us. And that's why for most people, their cancer isn't caused by just one thing. It's usually a combination of factors that's led to enough damage in the body to cause one cell to become cancerous, and then that one cell grows and divides. So although this is how most people get their cancer, there are some people that get cancer for another reason, and we're going to talk about that. So our bodies, now hang on with me. I know this is a little bit of a technical slide, but basically our bodies are made out of many different parts that work together to create our properly functioning us. The tiny structures that make up our bodies are called cells. Our bodies are made of millions of cells and they interact with each other. So each cell knows what to do because it has a set of instructions inside of it. So the cells that make up our eyeballs know to be there and not in our, fingertips or something like that. So they all work together and they all have a set of instructions on how to grow and function properly. And these instructions are called our genes, and they're in our DNA. So our genes help our cells know what type of body part to grow and how to act. So our genes are why we don't have, toes growing out of our foreheads, and we have fingers that are able to move. That's because our genes are there to help instruct our bodies how to grow and develop and function properly. So we have genes that, help our eye color, dictate our eye color, how many eyelashes we have, and how many tears our bodies need to produce to keep our eyes wet. But some of our genes have a function and have actions that they do. So we're going to talk about those genes, the genes that aren't based on our physical appearance, but actually how our bodies function. So we're all born with a set of genes in our bodies that are there to protect us from cancer. They act like little bodyguards, and they may recognize a cell that's becoming damaged from our environment, the aging process, our lifestyle, and they recognize, hey, this cell is looking a little damaged, and they might try to protect us. So they would do that by recognizing the cell is not looking very well and getting rid of it, needs to be replaced. So these genes say, hey, there's a function that needs to happen. We need to maybe get rid of this cell. It's not looking very healthy. So those are our genes that work to protect us from cancer, our little bodyguards. We get these genes from our parents and we pass them on to our children. So we're born with these genes. They don't change over time, so they're not contagious. So, being close to a friend or anything, there's no way to pass these genes on like that. They're not any kind of contagious thing. They're something that we're actually born with. So our parents pass them on to us, and then we can pass them on to our children, and we share them with our siblings because our siblings also get their genes from the same parents. So some people are born with changes in their genes, so they're not able to properly protect the body from the damage that can build up. So without this protection, it means that we're more likely to get cancer, right? If we don't have as much protection from these cells that are starting to look a little damaged, then it makes sense that without that protection, there would be a higher chance of a cancer happening. So changes in specific genes are linked to specific cancers. So depending on which gene might not be working properly, it will guide the cancers that person might be at a higher risk for. So cancers that are caused by this decreased protection in our bodies, so these problems in these genes, they're called hereditary cancers. And hereditary because they pass through families. So we get our genes from our parents, pass them on to our children. And so it's called a hereditary cancer because it's a cancer risk, a chance of getting cancer that's higher than other people. And that risk can be passed through the family. Okay. So, this is really important. And it's really important because in 2021, on average, 628 Canadians were diagnosed with cancer every day. And that's from the Canadian Cancer Society. So cancer is a really common disease, and it's really important to be able to figure out why it's happening to Canadians. And that means that we can maybe help treat it better. So it's a common disease, and the impact of cancer really doesn't affect just the person who has it, but their friends, family, community as well. So it's really important to take the time to understand and appreciate the different types of cancers. So I want to stress, cancer is a common disease, and most cancers are not caused by problems in our genes. So hereditary cancer, most is not hereditary cancer. And the term hereditary cancer, of course, is used to describe cancer that's caused by a problem in a gene. And that really only accounts for about 10% of the cancers that we see. And so most cancers are not caused by changes in our genes. So then you might be asking me, okay, so why is it important to talk about hereditary cancer or cancer that's caused by problems in our genes? Well, one reason is that there's a higher lifetime risk for people with inherited risk factors for cancer. So lifetime risks vary by the gene and the cancer type. But here we're going to see a graph, and risks here are shown as a lifetime risk. So the lifetime risk from 0% chance, which is almost never possible. We all have a chance of getting any kind of cancer, but all the way up to an 80% chance of getting a cancer. In this case, we're looking at breast cancer. So an 80% chance of getting breast cancer within someone's lifetime. And on the left, on the y-axis, so the one that goes up and down, we have different genes. And these are some of our protector genes. So these are genes that are there to protect us from cancer, from breast cancer. So if somebody has a problem in one of those genes, we can see their lifetime risk can increase. So women without any kind of problem in their genes, any kind of genetic difference that puts them at risk for cancer, have about a 13% chance of getting breast cancer in their lifetime. So just the average person the average woman walking down the street has about a 13% chance of getting breast cancer. But when we look at this graph, we can see that for some of these genes, there's a really high lifetime risk. So, almost 70% chance. So that's actually saying that for some of these genes, if they're broken and not working properly, there's actually a higher chance that that person will get breast cancer in their lifetime than they won't. And that can be really important to know so that we can make sure we're screening those people and taking care of them in a different way than somebody whose breast cancer risk is about 13% in their lifetime. Now, I also want to be clear too, men can carry all of these genetic differences as well, and their risk for breast cancer and other kinds of cancers can also be increased. So about 1 in every 1,000 men will get male breast cancer if they don't have a genetic risk factor for breast cancer. But among men with one of these genetic differences, the chance can get much higher. It can be even closer to 70 men out of 1,000. So this is just one example that I'm using breast cancer to show, but these genetic changes that impact our cancer risk, they can affect all different types of cancer. I'm just using breast cancer as an example because there's a lot of data out there that helps me explain this concept, but it can happen for any cancer type. That basically these changes in our genes, these genes are there to protect us from certain kinds of cancers. There's multiple of these genes, lots of different ones, and depending on which one might not be working, we might see a higher chance of all different types of cancers. Okay, so I hope I've been able to explain what hereditary cancer is. It is a gene that's there to protect you from cancer that's not working properly. And you got it from one of your parents, and there's a chance you pass it on to one of your kids. That's what makes it hereditary. And depending on what gene isn't working properly, there are many different genes. There's over 100 of them. So depending on which one isn't working properly, you could be at a higher risk for certain types of cancers. Okay? And they're not all going to, not one is going to increase your risk for all cancers. So knowing which one can be helpful to make sure that you're getting proper care and that your family is getting proper care. So additional reasons that hereditary cancer is different from sporadic cancer. So sporadic cancer is that cancer that's just caused by our bodies just getting damaged and getting damaged and hurt over time. So those lifestyle, environment, aging, all of those things that damage us, that's what we call sporadic cancer or cancer by chance. So the reason hereditary cancer is different than sporadic cancer is that it can be passed on. So it can be passed from parents to child and then from that person to their children. So if somebody has a problem with one of their genes and it's not providing proper protection from certain types of cancers, then they could pass on that risk factor to their children. And that's regardless of the gender. So as we talked about, right, men can also have these genetic risk factors. So it could be that, a risk factor for breast cancer can be passed on to a son. And then that son might have a higher chance of getting breast cancer as well. So there's no gender bias, there's no sex bias here, that anyone can pass on these risk factors and anyone can inherit these risk factors. So it's important to know if we have a hereditary risk for cancer, because people with inherited mutations or genetic problems can pass on that genetic problem or that mutation to their children. Okay. Another reason it's important to know if somebody has a hereditary type of cancer is because hereditary cancers tend to occur earlier in life for people with a hereditary cancer risk. And it often is in a different stage of life compared to people who develop cancer because of the damage that just is normally accumulating in our bodies. So for example, women who are in college, they might be, dating or getting married or having children. That might be a time of their life that they're not thinking about cancer or expecting to get cancer and might not being screened for cancers. And so it can be important to know about a hereditary risk for cancer because younger people are at risk for cancer if they carry these genetic risk factors. Similarly, right, men with these genetic risk factors might also not be aware that they need extra screening or extra cancer care and attention earlier in their life if they have one of these genetic risk factors as well. So one reason it's important to recognize and look for the hereditary form of cancer is that hereditary cancers tend to develop at a younger age. So those are people that might not be getting screened in general. So it's really important to be able to find those people before they need that screening to be done. And people with an inherited genetic risk factor for cancer who have been previously diagnosed with cancer, unfortunately, might also be at an increased risk for a second or a third cancer. Gosh, what a heartbreaking thing to have to talk about. But this is another reason that it's really important that people who have already been diagnosed with cancer consider genetic counseling and genetic testing, because that might not be the end of their cancer story. And we need to talk about, what could happen in the future. So people with one of these genetic risk factors for cancer might not have just one experience with cancer. And then, hereditary cancer and these genetic risk factors, they can also help doctors understand what's someone's chance of having a recurrence. So once their cancer is gone, what's the chance that it could come back? And help doctors figure out, what are some parts of this cancer that might help us know what to expect for you in the future. So for hereditary cancers, there might be a higher chance that something could come back, or that a totally new cancer could develop. And that's really important to know as someone's planning out for their patient, what in the future, how often are we going to meet, and how often are we going to screen you, and what's the follow-up plan going to be? So it can be really important to get this genetic information to make sure that in the future, you're getting just as great care as you got before. So then for people with cancer who have one of these genetic risk factors that probably caused their cancer, a genetic test might lead to different treatments. So genetic testing results can affect the treatment plan. So some people with certain genetic risk factors are actually eligible for different clinical trials, or there's even medications that are specifically tailored to help people who have one of these genetic risk factors help get rid of their cancer in particular. So there are clinical trials, there are different kinds of medications that could be used, and there could be surgical outcomes as well based on genetic testing. So if somebody has a genetic test that says that their breast cancer was caused by a genetic risk factor, and that the chance that they would get another breast cancer in the future is actually pretty high, they might choose a surgery that helps reduce that chance by removing all of the breast tissue. So that's called a bilateral mastectomy, as opposed to a smaller procedure, something like a lumpectomy. So just taking out a small part of the breast as opposed to all of the breast tissue. So there could be different implications of this information when it comes to surgery as well. So it can be really important to have a discussion about genetic testing because it could impact somebody who currently has cancer, could impact what treatments are available, any clinical trials that you might be eligible for, and then any kind of surgery decisions. It could help to have that conversation and help manage those surgery decisions as it might lead you to make a different choice when it comes to your body and the surgery that you're choosing for yourself. And then we get to this weird word, previvors. So previvors they're not survivors of cancer, they're previvors. These are individuals who have a genetic risk factor for cancer, but they haven't had cancer. So they have different screening and risk management options. So this is really ideally when we want to find people who have these genetic risk factors for cancer. We want to find them in the previvor stage. So they haven't had cancer yet, And we want to try to keep it that way, right? So if we can identify somebody who has this really high chance of getting whatever type of cancer, we might initiate some actions to try to prevent that from happening to that person. That could look like increased screening. So we might be trying to detect a cancer at a much earlier stage to make sure that it's more treatable and easier to deal with for that person. We also might be talking about medications. So there are certain medications that we can use to help decrease someone's chance of ever getting a cancer. We might be talking about surgery. Okay, that's called risk-reducing surgery or prophylactic surgery. It's surgery that's done before there's a cancer to try to prevent that type of cancer. So for people, for example, for a woman who has an 86% chance of getting breast cancer over her lifetime, she might choose to remove her breast tissue and maybe follow that with reconstruction or not. But she might choose to try to decrease her chance of ever getting that breast cancer by removing her breast tissue. Okay. There are some types of cancers that we do recommend that for. So this preventative type of surgery. And one of those types of cancers is ovarian cancer, because right now we don't have very good screening for ovarian cancer. So when we identify somebody who has a genetic risk, a higher chance of getting ovarian cancer based on a problem in their genes, we might want to talk about what removing the ovaries might look like for them in their life, so that they can let us know if that sounds like something they're interested in versus, understanding the risk of potentially getting ovarian cancer and having it be a hard type of cancer that we can find early. So let's all just remember that this all depends on which gene has a problem. Okay, there's no way to reduce someone's cancer risk 100%. Okay, we never give. I'm sure everybody on this call has felt the frustration that in medicine we never give 0 or 100% chances. We're always talking in the middle. So there's never a way to reduce your chance of getting cancer 100%. But there are actions that we can take to significantly decrease someone's chance of getting cancer if we know exactly what gene has a problem and what cancers we need to be aware of. So these have all been reasons why it's important to learn about hereditary cancer, about these genetic risk factors for cancer. However, it's unfortunate that most people who have these genetic risk factors haven't had genetic counseling or genetic testing or a conversation about genetics with their family. In fact, 90% of the millions of people who have a genetic predisposition for cancer are unaware. And that's my main driver for wanting to be in front of you. And I'm so grateful for giving me a platform to discuss this. Thank you very much. Because these 90% of people with these genetic risk factors that don't know they have one, we can change their life and we can change the story of cancer in their family. We just need to get the word out that genetic testing is important to be able to do that. So thank you for taking the time to hear this today, and thanks for giving me the chance to explain some of it. So why would we do hereditary cancer genetic testing? Well, there are really 4 main reasons, right? So one is therapeutic decision making. So we can have different ways of treating somebody who has had cancer. So that could be medication changes, it could be surgical differences or clinical trials, like we talked about. And then screening and prevention. So if we find somebody before they've had cancer, we can take some action to try to prevent them from getting cancer. Or for people who have experienced cancer and might be at a higher chance of getting another cancer later on in their life, we can make a plan to try to screen them appropriately to make sure that if anything does grow in the body, we find it at an early and more treatable stage, and even try and prevent those cancers through certain medications that we can help to reduce someone's risk, as well as surgeries that can help, get that chance of that type of cancer as close to zero as we can get by removing that part of the body. The fourth reason that a lot of people consider genetic testing is for their family members. So as we talked about, we get our genes from our parents and we pass them on to our children. So if somebody is found in themselves to have a genetic risk for cancer, most of these risk factors can be passed on to children at a 50% chance. So for each child, there would be a 50% chance, each of them, that they would inherit that same risk factor from a parent. So for lots of people, a motivating driver for discussion of genetic testing is just the thought, I don't want my children to have to go through this. And if I can get some information that might help in their ability to prevent cancer for themselves, then I should at least have the conversation about if genetic testing could be helpful for me. And then answers. It can be really challenging for families that have a long history, lots of stories with cancer. It can be challenging for people who are really young and got cancer unexpectedly. And sometimes genetic testing can help provide answers as to why is this the story of my family? Why is cancer seeming to be the common theme and generation after generation? Or for the person who says, I'm 30 with breast cancer, how did this happen to me? Well, genetic testing can sometimes give us an answer as to what happened. So sometimes those answers can give us some closure and help us make sense of these really challenging topics. So who should consider genetic testing? Well, genetics is a relatively new field of medicine, and we continue to learn a lot each year about the link between our genes and cancer. So that means that each year we discover new genes that are linked to cancer, and our understanding of these genes get better and better. So basically over time, we've sort of settled on this, that if somebody in your family or who's related to you by blood has had genetic testing and has a genetic risk factor that's linked to cancer, you should probably get genetic testing to see if you share that genetic risk factor with your family member. If you've had cancer and a genetic test is done on your cancer and it finds that you might have been born with one of these hereditary risk factors, then you should have this kind of genetic testing. So your oncologist would be the one who would let you know that, hey, there's a hint in your cancer that you might have been born with a genetic risk factor. And that definitely your oncologist will be the one to walk you through if you meet that kind of reason for genetic testing. And then anyone that's had genetic testing before 2014, and their test was negative or it wasn't helpful at that time, they could consider redoing that test. And that's because we learn more and more every year. And since 2014, our knowledge has expanded to the point where basically tests that were done that long ago are now not really considered very helpful. Yeah. Okay, now we get to the nitty-gritty of, for you, should you consider genetic testing? So if you or any of your family members have had pancreatic, ovarian, or male breast cancer at any age, you should consider a conversation about genetic testing. If you or your family members have had breast, colorectal, so that's colon cancer or rectal cancer, gastric, which is stomach cancer, or endometrial cancer, before 50, at 50 years old or younger, you should have a conversation about genetic testing. Now, it's not to say that these types of cancers over 50 aren't necessarily caused by a problem in somebody's genes. It's just to say that it's more unlikely. So like we said, hereditary cancer or cancer caused by these problems in our genes tends to happen in younger people. So that's why we have those ages in there, is because that's a higher chance of that person having a genetic risk factor if they've had these types of cancers younger. So then for a man, prostate cancer at 55 or younger, or metastatic prostate cancer. Those are reasons to talk about genetic testing. And a woman with triple negative breast cancer at 60 or younger is another reason. As well as if you or your family member, I hope not, have had 2 or more cancers, that's definitely an indication that you should have a conversation about genetic testing. And then there are some specifics about certain types of cancers. So again, an oncologist would go through those with you, but specific types of colon, rectal, and endometrial cancer that have these certain markers in them that aren't really important, but what they do is they tell an oncologist, hey, this person might be born with a genetic risk factor that caused this cancer. And then any kind of rare or really young cancer, and then anyone that's had 10 or more colon polyps. And polyps themselves are not cancer, no need to be concerned. Polyps just can turn into cancer over time, and it's pretty unusual to have 10 all at once. So maybe 10 across the lifetime, but 10 all at once means, hey, there's something a little unusual happening in this person's colon, and it might be time to talk about some genetic testing. And then if 2 or more people on the same side of your family, so if you think about your mom's side and your dad's side, if 2 or more people just on mom's side or 2 or more people just on dad's side have had the following types of cancers, breast, colorectal, endometrial, melanoma, which is a certain type of severe skin cancer, ovarian, pancreatic, prostate, stomach, or other rare cancers or younger onset cancers. Those are also reasons to consider talking about genetic testing with your healthcare providers. So let's talk about the limitations of genetic testing, because it's not perfect. Okay, so the first limitation is that not everybody meets criteria to get genetic testing. So not everybody qualifies for it. Results can be confusing. They're not always straightforward, and it can be really helpful to have a genetics expert like myself to talk through them with you, because they're not always clear. Genetics, again, is a still new, relatively new field of medicine, and we can sometimes get confusing results. So it can be helpful to have a genetics expert on your side to help walk you through what they mean for you and what those results mean for your family too. Some of my patients have told me that the knowledge of a genetic risk factor can be a heavy burden. And in particular, that can feel like a heavy burden when they want to talk to their children about it. I oftentimes say, try and reframe that and say, I understand that it feels like that, but really this was there, whether you knew about it or not. So you can't change your genes. There's no way to eat enough broccoli to fix a genetic risk factor. It's there, you were born with it. You have no control what you pass on to your children. Again, no amount of broccoli when you're pregnant is going to change what genes you pass on to your children. So isn't it better to know? The gift of knowledge means that potentially you could be saving their lives. So I always try and reframe that as kind of like an early holiday gift that you're giving your family, is the gift of knowledge, and the knowledge that you might, take some extra precautions to keep you safe. And then there can be emotions that come up with genetic testing, including guilt, fear, anger, helplessness. So feeling like there's really no action that can be taken. And I hope I've been able to give some guidance as to the actions that can be taken with this knowledge, and help empower everybody to take control of this knowledge, to make those decisions for their own bodies, their own healthcare, and their family's health. And then some family members don't necessarily want to know the information. And everybody has a right to make choices about their own bodies, but it can cause friction and tensions in a family if there are 2 different schools of thought when it comes to genetic risk factors and knowing about them. And then, we have seen cases where genetic information was used against individuals when it came to insurance, but I'm really glad to be able to update that conversation and help alleviate any of those fears that might be coming up here in this talk. So there is a Canadian law. It's called the called the Genetic Information and Non-Discrimination Act. It does allow, it means that an insurance provider and nobody can use genetic information in any way against you. So it's the same in the United States, that genetic information can't be used against anyone when it comes to their healthcare or any kind of insurance. So that's really good to know. This was established because at one point in time, there was genetic information that was being used against people, primarily in America, to deny them life insurance. It was being called a pre-existing condition. And so any of their cancer treatments were not being covered. And this was obviously unacceptable. And there is a federal law in the United States and a national law in Canada that prevents that from continuing. So I'm very happy to be able to say that. And then you also, of course, have protection of any of your health records under the Personal Information Protection and Electronic Document Act. So that's the same protections as if you were to go and get an X-ray. That information would be protected under the same laws as any genetic testing would be protected under as well. Okay, so let's talk about what to expect if you do decide that a genetic test might be right for you. So when you go for a genetic test, you'll be asked to give a blood or saliva sample. So someone might take your blood, you might be asked to spit in a tube, or you might use a little Q-tip and swab it on, in between your gums. And this is going to be used to extract your DNA, to get your DNA. So once your DNA has been gotten at the lab, then we're going to look at it and see if there's any genetic changes in your genes that would cause a higher risk of cancer. So basically, of the over 100 genes that are your cancer protecting genes, do any of them look broken? Or do we expect that they're all working properly and protecting you properly from cancer as best they can? We know that this damage that builds up in our bodies over time, sometimes it can get past our little cancer protectors. So it's not a perfect system. Our genes do the best they can, but they're not perfect. Okay. What we're really looking for is, are any of these little cancer protector genes broken? And then from there, it would be told to you that, yeah, there is something here that you need to be aware of. And here's the plan moving forward. So let's talk about the kinds of results that you can get back from genetic testing. So a positive result, it means that, yeah, we did look at those little cancer protecting genes and we found that one of them isn't working properly. From there, we're going to talk about, what does that mean for you? What does that mean for your current healthcare, your future healthcare, and what does that mean for your family members? Okay, what does that mean for your children, your siblings, and your parents? Okay. You could also get a negative result, and a negative result means we looked at all the genes we know of today in 2022, and we looked at all those cancer protecting genes, and they all look pretty normal to us. So they're doing the best they can. It means that probably the cancer that you experienced was not caused by a problem in your genes and was caused by just that damage that builds up every day that we wake up and live our lives. We have another type of result that we can get back. It's called a variant of uncertain significance. It means that there was a change, a little difference found in one of your genes, but we don't know enough about it to know what it means yet. Now, it happens all the time because genetics is a relatively new field of medicine and we're still learning. When we get a result like that, basically, we'll keep track of it for you and we'll let you know when it's figured out. It can take some time though. So for the meantime, we just make sure that we use all the information available to us at the moment to make plans about current healthcare, your future healthcare, and your family's healthcare. But we're going to sort of ignore any kind of uncertain result until we get some definitive answers. And that can just take some time because, yeah, we're still learning in genetics. So I wanted to briefly touch on what we call direct to consumer tests. So this is a test that you can go into a a pharmacy or a drugstore, and you can just pick off the shelf and do it for yourself. So tests that are marketed directly to consumers, so directly to the population, without any involvement of a healthcare worker, so without any healthcare provider helping you with it, these are called direct-to-consumer tests. And most direct-to-consumer tests they're not for medical purposes. So you might have seen some of them related to ancestry testing. I know that I have a friend that did one for her dog and got to know what kind of different parts her dog is. It was very fun. But they're not like FDA approved. They're not really useful in a medical context. And some of these direct-to-consumer tests that are approved for some medical usages, they're not very good. So it's important, to think about when I get a genetic test, if I'm going to utilize it for my health currently, my future health, my family's health. These are really important things, and I don't want to just get information that might not be the most helpful or might not be the most comprehensive. So I would just highly recommend never to do any kind of genetic test that isn't for fun, any kind of genetic test that you're going to use to make decisions about your health. I would highly recommend that you don't use anything that doesn't involve a healthcare provider. And that's because if you're going to use it to make decisions about your healthcare and your family's healthcare, we want to make sure that you get a really good test done. So you have a good baseline of trustworthy information that you can build off of for your health and your family's health. Okay, I wanted to, again, just really briefly touch on the difference between two different types of genetic testing. So we have something called hereditary genetic testing, which is what we've been talking about this whole time. So these are these little gene problems that are in every one of our cells, and they can be passed through families. So we get them from our parents, they're in all of our body, and we pass them to our children, and they might affect one certain part of our body, making it at risk or a higher chance of getting a certain type of cancer. There's also something called tumor genetic testing. It's also called somatic genetic testing. So these are genetic changes, differences that are only in a cancer. So they're found just in that cancer tumor. They can't be passed to family members. So they're not inherited from a parent and passed on to children. And this type of genetic testing, it's really used to help see, are there any genetic changes in this cancer that we can use, that there are certain medications that we can use to then get rid of this cancer in a better way. So it's a very different type of genetic testing. And I just wanted to make sure that those two things are very, differentiated, that you might have two genetic tests done as part of a cancer journey. One is that a small portion of your tumor is removed or your entire tumor is removed, and they tell you, hey, we have a medication that is going to work better on your cancer because your cancer has this genetic mutation that we can target for this medication. And the flip side is they say, oh, now we need to do another genetic test. And you might think, hey, I already had a genetic test. I've been poked and prodded enough. You need to give me a break. But if they're talking about a hereditary genetic test, that's saying, okay, we're not looking at genetic problems that are just in your cancer. We're looking for the answer of, was there a genetic problem that caused your cancer? So it would be something that would be in your whole body, but is the reason that this cancer developed and would be important for your healthcare and your family's healthcare, because that type of testing can impact your family as well. That's why it's called hereditary cancer testing. So I've talked a lot, and I'm really grateful to have had the chance to give some information. I know it's a lot to take in. So I'm very, very happy at this moment to answer any questions. And of course, if I can be helpful in any other way, I hope that you'll let me know.
Well, thank you, Thank you so much, Rachel, for this incredible presentation. I know I've learned a lot, and the way you presented it was so easy to follow, and you answered a lot of questions that I'm sure people were going to be asking, but you had a lot of answers that people may have wanted to ask. However, we have had questions coming in, and I'll start off with some questions that came to mind, and then we'll go back and forth with Jen and do as many questions as possible. And like you say, if we don't get to all of them, you look like you're the type of person that will just be very happy to answer anything that comes along. So I have a quick question for you. In terms of testing, someone who's, breast cancer, women live with for 30 years. If they have an early diagnosis with estrogen positive, tumor, and that they can go on for a long time even without getting a relapse or a recurrent. What are your recommendations in the field in terms of going for a genetic testing for somebody like this?
Yeah, so I guess I think everybody's journey is different, and everybody has a different connection to what they want to know. My firm belief is that everybody should be able to access the information that they want to have about their own bodies. So for some of my patients, they would meet with me and say, Rachel, I don't want to know. It's too much for me. I'm overwhelmed already. I think that for me, ignorance is bliss, and I just can't handle any of this. Great. I feel like I did my job empowering someone, making an environment that someone felt comfortable explaining what they need to me. Fantastic. There can be other people that say, Rachel, I feel so confused by how this happened. I've never seen cancer in my family before, or I have a bunch of relatives that have had cancer, and I feel like I want more information. I want to know, was I born with a risk factor for this? Was this sort of destined to happen to me? Was there some kind of action that I could have taken to prevent it? And can I give my family members some guidance as to maybe how they could prevent it from happening to them? And for that kind of person, I would say, I think genetic testing might be helpful. So I think it might be helpful to figure out what happened to you, and if there's any information that could be used for your future healthcare and for your family. So I would definitely encourage everyone to just take a moment to reflect on what of those feels right to them, and then talk to their healthcare providers, because there are options out there. And even if you don't meet provincial guidelines for genetic testing, there are good options out there as well. And certainly people can reach out to me, and I'd be happy to help with that too.
Now, this leads me to a question about having somebody with results that you have now discovered this is in your DNA, in your gene, and over your lifetime, this may or may not happen to you, but we're going to follow you. How many times could they see a Rachel during the time that they may be anxious as they lead their lives, which may or may never occur? And if they're young, they can have a lifetime thinking about this. So what is the long-term care for experts like yourself? And how do you manage individuals like this with higher anxiety levels and are more unsatisfied with just knowing and walking away?
Yeah, that's a really, really great and important question. And unfortunately, it kind of highlights a bottleneck in our Canadian healthcare system, that there really aren't enough genetic counselors like myself in practice. So most of the time when I was seeing patients, I would see them once. So I would talk them through their results, I would write out a plan, and I would make sure that their oncologist, family doctor, and any other specialists that they were seeing got a copy of the plan, as well as them, of course, and help communicate, these are the actions that need to be taken over time. I tried to make myself as available for any kind of follow-up questions as possible. Of course, as I hope I've been able to communicate clearly, I want everyone to have the information they need. So I definitely prioritize that when I was in clinic and prioritize it now. But there aren't enough of us. So in some provinces, the wait time to see somebody like me is over 2 years long. So you can imagine that the follow-up care is not going to be very comprehensive. There are certain organizations like yours that can help provide some gaps. So help provide information in a broader context, like this wonderful, brilliant educational webinar series that you're providing to help fill those gaps in our healthcare system. There are patient advocacy groups, there are, support networks that are out there, but unfortunately, from a medical perspective, it can sometimes be hard to give the level of care we all want to give based on the restrictions, just the personnel restrictions that we have.
So in terms of, your presentation, talking to preventing with the screening, okay? When you're discovering something is in your gene, you say, well, maybe we can prevent it if we understand it and see it early on. Is there such a thing as preventing some cancers from appearing?
Yes, absolutely. So when I was talking to people who had one of these genetic risk factors, I'd say we've kind of got sort of two paths in front of us. So path one is a detection path. So we can sometimes detect cancers when they're very small and earlier to treat if we use the right screening methods and we do them frequently enough. So for breast cancer, for example, we have multiple ways that we can screen for breast cancer using mammograms, MRIs, and we can do those at a frequency that maybe we would find a breast cancer when it's at a much smaller and treatable stage if somebody is at a higher risk for breast cancer. Now, the flip path that we can take is the prevention path. The prevention path is trying to not find cancer, it's trying to prevent cancer. So those are things like medications and surgeries. So it's really hard to get breast cancer if you don't have breast tissue. So if we know somebody has a genetic risk for breast cancer that's really high risk, and they consider all of their options and say, I think that I want to try to prevent that from happening to me, then one way we can do that is through removal of all of the breast tissue. That's called a prophylactic. So before there's a problem, prophylactic bilateral, both breasts, mastectomy, prophylactic bilateral mastectomy. And there are certain types of cancers that we can prevent through surgically removing that part of the body. So there are certain parts of our bodies that we don't need to live. And if we remove those parts, the chance of getting that type of cancer is unfortunately not zero, but it's as close to zero as a human can possibly get. And then, of course, there are certain medications that we can prescribe to help try to prevent that person from ever getting that type of cancer. So depending on the type of cancer that someone might be at risk for, we could have different options when we think about that detection path or that prevention path.
Okay, that's clear, because I don't want anybody to misunderstand that cancer could be prevented. It can't be prevented in all cases, right?
No, not in all cases. Unfortunately, there are parts of our bodies that are impossible to screen for and we can't live without. I don't know how anyone else here feels, but I need my brain. I can't live without it. It's really hard to screen for brain cancers. There's lots of types of cancers that are hard to screen for, and we can't live without that part of our body. So not all types of cancers we're going to have that those options available for. But for most of the genetic testing that we do for the hereditary types of cancers, we're really focusing on those types of cancers that we do have some options with.
And again, keeping to the same topic, how often do you recommend someone who's been tested once, has some mutation or gene that could develop? How often do you recommend they come back for testing? What's the frequency?
Yeah, that's a wonderful question that I unfortunately don't have a good answer to, because at this moment, all I can say is that if you had a genetic test done before 2014, I would recommend revisiting if nothing was found. So if you had a negative genetic test at this point, our knowledge is so much better than it was in 2014 that your test might not be negative if you did it again, if that makes sense, because we've learned about so many new genes that are linked to cancer. Going forward, I don't know, because I don't know, maybe we've, I think it's unlikely, but maybe we've discovered all of the genes that are linked to cancer and we're done learning now. So if you had a test done today, it would be relevant for forever moving forward. I think that's highly unlikely, considering we've learned since 2014 about over 100 new genes. So I think it's unlikely, but I don't know what the frequency would be. I would say if your genetic test was negative, I would recommend at least every 10 years, check back in. Why not? You know, a decade goes by, a lot happens in a decade in medicine and science. I think that 10 years, you know, can put that in the calendar every decade, check in and see, is there something new? But if you're feeling motivated every 5 years, you could just ask the question. There's really no harm in asking, right? It's just a question.
Sure. And where do we stand in terms of it being genetic testing being a standard of care, and how is it across the country?
Yeah, so that's a wonderful question. So genetic testing is commonplace, and it is standard of care for certain people. So certain people that have young cancers, like have gotten cancer young, have rarer types of cancers, or have, you know, themselves, you know, had multiple cancers, which is just so heartbreaking. So there are certain types of people that have something pretty unusual happening, and the province will pay for them to have genetic testing. So it is done across every province and territory. It is a commonplace thing that is done. It's just that the guidelines for who gets the test covered by provincial healthcare can sometimes feel a little restrictive. So if it's something that you're interested in, there are other options. There's really only one good other option. And again, I would be happy to help anyone navigate that if they would like it.
Okay, great. So I'm going to go on to a question that came in from the listeners. And this person writes, I have the CHEK2 mutation. What does that mean for my children? Should they be tested to see if they have the same mutation?
That's an excellent question, and I don't know the answer off of the top of my head. That's not a gene that I'm familiar with. I would be happy to take a deeper dive. Kathy, would you mind, if this listener doesn't mind, I'd be happy to get more information and send it to them separately. But those are really good questions to be asking the person that ordered the genetic test for you. So whoever got you that information, they should definitely be the ones to help explain it to you. If you don't feel like you got an adequate answer for those great questions, I can help find someone to get you those answers, but the person that ordered your genetic test should be the person who can help explain it to you. So I would probably shoot those questions back to your healthcare provider, because they're the ones really ultimately who are going to be following you and making your healthcare plan. So they're kind of the ones that need to know what these genetics results mean to you. And they're the ones who, you know, you should have a relationship with, that you can ask the question of, what does this mean to me? You know, if they ordered the test for you, I think that it makes sense to ask them, you know, why and what does it mean?
So the listener is saying that she wants to be either in touch or further information. Jen, can you flag that?
Absolutely. Yeah. And I've sent a private message to that person so that we can keep in touch.
Sounds
great. I'm going to go to another question, and then I'll probably hand it over to Jen for other questions. Is HER2 positive breast cancer usually passed on to daughters?
That's an excellent question. So when we're talking about HER2 positive, negative, ER, PR, all of these different things, what we're looking at actually is characteristics of the cancer. So our cancer cells, they start like normal healthy cells. So imagine there's this Rachel, and then there's identical twin Rachel, okay? And as we're growing up, you know, I play soccer and I get straight A's, and my twin sister starts doing some weird things. She gets, you know, she starts stealing money from mom, and maybe she causes some trouble. And then over time, she just gets more and more troublesome, to the point where like she's really breaking lots of laws and becoming a total menace to society, and I become a genetic counselor. So that's kind of what happens in cancer, that there are two cells that start the same, but one over time gets worse and worse and worse. So when we're talking about HER2 positive, negative, ERPR positive, negative, these are ways that we're using to describe what's different between me and my twin. And those differences are things that we can target with medications. So if we say, oh yeah, like menace to society, twin sister over here, she's HER2 positive. So if we give this medication, then only HER2 positive Rachels are going to be destroyed. And that's good news for this Rachel, because I'm healthy and I'm working properly. I don't want to be destroyed. So that's when we're looking at the characteristics of cancer, we're getting information that's used to help treat that cancer, but it doesn't give us information about what could be passed on to our children. So the only kind of test that can do that is a hereditary genetic testing, genetic test. So that's the one that we were talking about. So it's different than that HER2 positive or negative, because it's not going to be looking at the same thing. Yeah. I hope that information was helpful.
Okay, great, thanks. One more quick follow-up. I guess I could ask, what are the causes to change our genes? So that kind of is within that question, the earlier question.
Yeah, so that's a great question, and it's evolution basically. So over time, changes happen in our genes. It's very rare that they happen and they cause a problem. We all have differences in our genes, right? It's the reason that we all look different here and we sound different and we have different senses of humor. It's because we have differences in our genes. So it's totally normal to have differences in our genes. And most of these differences, they don't hurt us. They're just how we are unique as individuals. Every once in a while, a change will happen that is harmful, and then it can be passed through the family. It's very rare, but that's how these genetic problems start. But mostly they've happened many generations in the past, and they're just passing through a family. So it's very rare for someone to be the first person in their family to have one of these genetic risk factors. It's usually inherited from a parent.
But some people will not know this, right? If they're the only ones that have that cancer, unless they do some genetic testing and they just move away from it and then go into the horizon and never find out about this, right?
Yeah, unfortunately, cancers are a very common disease. It's, in the top 4, reasons for death in Canada. So it's a common disease. It impacts every family. And without a genetic test, it's impossible to know if we carry one of these genetic risk factors, because there's a lot of cancer. And like I said, right, 90% of the people that have one of these genetic risk factors don't know they have it. So yeah, you're absolutely right, Kathy, that it is important to kind of take a moment to reflect, because yeah, a lot of these people don't know that they have these genetic risk factors.
Thank you. So I'm going to hand it over to Jen. I think Jen has a few questions from our listeners, right?
Yeah, so just actually going through the chats, Rachel and Kathy, a lot of questions about how to access testing. So first of all, I know you discussed the various certain settings that may put you at higher risk. So maybe you could get testing through the health system. Your doctor could order it. Your oncologist could order it. OHIP covers it, or whatever province you're in, the public health system would cover the cost of that. If you don't fit in those parameters, is there a way to get testing that you could pay out of pocket for? Are you able to speak to a couple of those? And what's the cost? Like, are we talking thousands of dollars? Hundreds of dollars? How can people access genetic testing that can't get it through the public healthcare system?
Yes, that is an absolutely fantastic question. That is a fantastic question. So I'm trying to get a link from my other screen. Sorry about that. But okay, if I would highly encourage everyone to talk to their doctors first. First things first, they know you, they know your family, they are the people who are going to put into action a plan. So they are the best people to talk to first. If your family doctor or your oncologist says, I'm really sorry, but you don't meet the guidelines to get this testing, and you still feel really motivated, like, I want to know. I went to this talk by Rachel. I feel really, really motivated to know. She dictated who might want to know, and I really felt connected to that category of people, and I still want to know how to access this. To my knowledge, there's only one way to get a really high quality, good genetic test that you can get for yourself. It's the reason that I work for the company that I work for, is that they are creating a test, that they have created a test that is available to the public, that is the same quality and caliber of test that I ordered from my patients clinically. I don't know of any others that are out there. And if I'm able to figure out my own screen, I will put it in the chat, actually, so that I can show everybody where I would go. Actually, okay. I can actually do that right now. So I'm just going to share my screen really quickly. So I work for a company called Invitae. They're a genetic testing company, dedicated to the same goals as me: knowledge access for our community, and making sure that genetic testing is available broadly. Again, it's better to get this done through a provider, but there is an option that you can access yourself. And to my knowledge, this is the only one that is good. So this is the cancer screen here. It looks at 61 different genes that are linked to all different types of cancers. And you can see the types of cancers here. And it's called a proactive screen. So you will actually talk to a medical provider who will order your test through Invitae, and then you'll have access to a genetic counselor like myself to help walk you through what that means to you and to your family. So it's basically like talking to me. In fact, you might talk to me. So it's not basically, it is exactly like that. And you will talk to a medical provider, which is why it's different than just going to a pharmacy and pulling something off the shelf. And it's actually the same test that I would order for my patients clinically. So it's an excellent test. It's comprehensive. There's follow-up care for when you get a result. You need help with that. Your providers need help knowing what to do with it. There's all the care and attention that can be provided through that. And it's $250 US. So I know that, many years ago, we used to think about genetic testing as completely unaffordable. It was, many thousands of dollars, and it was, that was quite a barrier. So I'm not sure how $250 sounds to everybody, but that's now the price of where we're at. So yeah, I just put the link in there. So that's for our Canadian. That's our Canadian side. So we do have a Canadian branch, and I don't mean to be biased about it. I know that I tried really hard to not talk about my company at all. There's just a reason that I'm with this company. And one of the reasons is that it provides this test. And for any of my patients that I talked to, that their partners then wanted to get testing. So I did, I offered this test that they could order for themselves, often for husbands, people that then got the information about genetics and felt, well, hey, I want to know about myself too. And there's actions that I can take. And I might have a family history of cancers too. So I've used this a lot, and I found it to be a very good product.
I think that's really helpful. And that answers a lot of the questions around how to access that. And then also, if you need to be retested, there was a couple comments about retesting, having been tested 10 years ago, and whether or not you qualify for that. And I don't know whether or not you qualify for retesting once you've already been tested, but just it's really helpful for people to know where they could go if it's just not covered or not feasible within the health system. So I think that's helpful to know. Kathy, do you have another question for us?
Yes, I do. Is there specific genes for triple negative? And second question, when they run genetic tests upon triple negative diagnosis, do they check all cancer hereditary genes? Oh, that's a good question. It's like, is there, that's a two-parter. Good.
That's a great question.
Yeah.
So triple negative breast cancer is, okay, let's start with this. Yikes, I'm sorry. Whoever wrote that, I'm really sorry. It sounds like you've had a really hard cancer experience, and triple negative breast cancer is a rare type of cancer and is a harder to treat type of cancer. So thank you for writing that question, and I'm sorry to hear that you had to ask it. Yes, genetic testing is available for anybody who's had triple negative breast cancer through almost every province. And that's because triple negative breast cancer is more aggressive than other types of breast cancer, and it's more rare than other types of breast cancer. So anything that's kind of rare automatically sort of triggers our thought process of, could that be genetic? Because genetic and rare kind of go together. So triple negative breast cancer is a rare type of breast cancer and therefore does qualify someone for genetic testing. And Kathy, I'm really sorry. Do you mind repeating the second part of that question? It was brilliant, and I want to make sure I answer it.
The second part is they're asking if do they do other genetic tests, like other testing outside the triple negative? What other testing do they do when they test for these genes?
Right. Thank you. Thank you for repeating that for me. So there's two schools of thought when we think about genetic testing. One way of doing genetic testing is, okay, this person in front of me has triple negative breast cancer, and I'm going to look at all of the genes that are linked to breast cancer risk and see if there's a problem in one of those genes that would have caused her breast cancer. Okay. Seems logical, right? That kind of makes sense. The other way of doing it is, this person in front of me has a rare cancer type. I don't know everything there is to know about cancer right now, and we continually learn. So why don't I look at all of the genes that I currently know that can cause any kind of cancer and evaluate that person to answer the question, what caused this person's cancer? And are they at risk for any other type of cancer? So that's a much bigger type of test. Now, every provider does it a different way. I would say that for me, I always erred on the more information side. I think I've probably made it clear at this point, I'm an information is power type of person. And I feel like as long as you have, your healthcare providers on your team ready to help you with the information, there's nothing scary about information. It's just used to make sure you're getting the best healthcare that you can possibly get. So I always erred on the side of, let's test you for everything and we'll see what's there. So maybe we find a risk factor for colon cancer that we were totally not expecting. But hey, at least now we know, and we can take some action to either try and detect cancer early or prevent cancer completely. So it kind of depends on what you and your healthcare provider feel is right for you and your body. The test that I put in the chat, it's going to look at all the genes linked to all of the cancers. So it's that broader perspective, which is more of what I, lean towards. But of course, for everybody, the information, it needs to be what you need. So if you think that that's information that you don't really want and is probably just going to cause you more anxiety or stress, then genetic testing just for the one thing that you're coming into the practice for is probably better for you. I hope that was a helpful answer.
Okay. Should someone without a family history of cancer that they know of still have genetic testing? This person writes that she was diagnosed with TNBC in 2020, was told she was not eligible for the testing given that she had a lack of family history. Oh,
that's hard. Yeah, so I'm sorry to hear that. In most provinces, triple negative breast cancer is automatically an indication for genetic testing. So I'm sorry to hear that you're maybe not in a place that is the case. I will say that I did genetic testing often for people without a family history. There are two main reasons. One is because someone wants to know. I mean, who am I to keep them from their own genetic health information, right? So at this point, you have a good option. You can pay to have a great test that will give you that answer and all of the clinical support for you to help navigate what the answer might mean for you and your family. The second kind of person that I would absolutely offer genetic testing for without a family history, anyone who's adopted, right? It's not their fault that they might have no information about their biological family. So again, if they want to know, we can't really use family history to help navigate how to take care of them. So I think that it is absolutely appropriate to say family history can help get somebody covered for genetic testing. But if that's not the case, I don't think that not having a family history is a good enough reason to deny yourself or somebody information that you might want to have. Provincially, though, we have to have rules, right? So even if I walk in and I want a whole body scan and I want the medical works, me wanting it is not enough. So we have a public system and we have to be careful with the funds that we have, because that funding helps me access a gynecologist and helps me get my preventative screenings and helps me when I break my arm. So we need to protect that central fund of money. So we can't just, do it for everybody that just wants the information, but now you have access to a way that you can get it if you do want it.
Okay, so this person writes, she was diagnosed at age 70 with breast cancer. Her oncologist said it was not a priority for her to have genetic testing, but it could be done at some point unless she wanted to pay directly for the testing. Is age a factor that makes a person higher on priority or not?
Yeah, that's a wonderful question. And the answer is yes. Age plays a large portion of, it plays a large factor of whether somebody is going to get a genetic test that's covered through their provincial healthcare system or not. So again, cancer is a really common disease, and most of it is not caused by problems in our genes. Most of it is caused by damage building up in our bodies over time. So the longer we live, the higher the chance we're going to get a cancer. And most of those cancers, again, aren't caused by problems in our genes, which is why the older we get, the less likely genetic testing is going to be offered, because it's less and less likely to be the explanation of why that person got a cancer. So at 70, the most likely explanation for why you got cancer is a combination of the environment, lifestyle factors, and the aging process. So unfortunately, I mean, I don't know about you, but I have to breathe. I live in downtown Toronto. I know I'm not always breathing the cleanest air over here. I can't control it though, right? I have to breathe. It's damaging me every time I go outside, and I go outside all the time with my dog. So I don't have an option. And over time, that pollution that I'm breathing in, the sun exposure I'm getting, I may occasionally drink a glass of wine. Don't tell anyone, but I don't always lead the healthiest lifestyle either, right? I have days that I don't get my exercise or whatever. And all of those things over time damage my body, right? And that's what causes cancer when we get to those later years. It's the most likely explanation, which is why genetic testing is less and less likely to be talked about, is because it's less and less likely to be the explanation of why that cancer happened.
Well, I would imagine at that point in time, somebody wants to know for their family. If they're the eldest in the family, maybe they just want to have it just so that their family members, if they have younger children, grandchildren, etc., So maybe
Sure.
that's why they're asking.
Yeah,
Okay.
and it's completely, there's no reason to not get the information. Like I didn't mean to try to dissuade anyone.
No, but I'm just
People, yeah, and it's available, it's available, right? It's in your DNA, and if you don't mind paying for it, you can get the information. So like you said, that, you know, it's less and less likely the explanation, but it's again, never is zero chance that it's the information. And like you said, that's information that could be helpful for the next generation to sort of pass down that knowledge. So thank you, Kathy, for making that clear. I appreciate that.
well, there's different reasons for why people want to do different things.
Sure.
But thank you for your great explanation. So I'm going to pass it on to Jen. If you have a quick one more question, and then I think we'll need to wrap it up and thank everyone. So go ahead, Jen.
We do. So we have one more question, but there are some we haven't had a chance to get to. Rachel will be joining us again on June 14th. I think at the same time, I think at 2 o'clock in the afternoon, if my memory serves me correct. And she will be spending the full hour and a half taking your questions. So if you did not get your question answered this time around, come back in a month and we'll do it all over again. But this one actually interesting for anyone who's gone through a cancer diagnosis. Does chemo and radiation change your genetics? And is that something cancer patients need to be concerned about, the impact of that?
That is such a good question. It is such a good question. So I'll be brief. There's a two-part answer. Does it change your genetics in a way that you could pass down a risk for cancer to your children? The answer is no. It doesn't change any risk factor that you could pass down to your children. So getting, it's the same as if you get an X-ray because you broke my wrist more recently. So that's why I keep saying break your arm. So if you break your arm because you're clumsy like me and you get an X-ray, that's not going to cause you to develop one of these genetic risks for cancer that you could then pass down to the next generation. But does it add to the damage that your body accumulates and could potentially, impact your risk to get another cancer? That answer is sometimes yes. So it's the same reason that you wear, I know I keep going back to it. Same reason I wore a whole lead outfit when I got my arm X-ray is because it does damage you. So it does increase the chance that you might get another cancer. Is that a good enough reason to not treat a current cancer? Absolutely not. You need to get rid of one before you start worrying about what the future holds. And your oncologist will work with you to create a screening plan to make sure they account for any of the damage that could have been put on your body through the treatments of your current cancer. That's an excellent question, and I hope that I've been able to explain it in a helpful way.
Okay, I think that was a good explanation, but like Jen said, we'll have the opportunity for anyone who wants to join us, and please do join us for the question and education session that will be coming later to everyone. I want to thank you all for your excellent questions. And thank you, Rachel, for answering all these questions. And I look forward to the question and education session. And again, thank you for your expertise. I want to take this opportunity to thank again our sponsors, Viatris, Novartis, Merck, AstraZeneca, and Pfizer, who's made this session possible. So I want to say goodbye and thank you and have a great day to everyone.